Hey there! If you're a clinician, administrator, or anyone working in healthcare, you've probably heard about Medicare stars and HEDIS measures. But let's be honest, these scoring systems can feel overwhelming. Today, we're simplifying it for you so you know what matters, why it matters, and how it impacts both patient care and your organization's success. If you ever felt frustrated trying to keep up with these scores, you're not alone. Let's get to the bottom of it together. All right, let's start with the STARS program. This is a way for Medicare to rate Medicare Advantage or MA programs. Think of it as a report card for MA plans. STARS ratings evaluate Medicare Part C and Part D. But what exactly are these parts? Medicare Part C, or Medicare Advantage, is a private insurance alternative to traditional Medicare that combines hospital, Part A, and medical, Part B coverage, often including additional benefits like vision and dental. On the other hand, Medicare Part D specifically covers prescription drugs, helping beneficiaries afford necessary medications. Each plan is assigned an overall score out of 5 stars. These ratings reflect the quality of care and service provided by the insurance plans themselves, not directly by individual healthcare providers or clinics. Higher ratings mean better patient care, fewer complaints, and stronger performance. Yes, but for insurance companies, they can also lead to financial incentives, rebates, and better marketability. That's why they want to maintain high-star ratings and protect their scores by carefully choosing which healthcare providers and organizations to contract, favoring those that provide high-quality care. Because these ratings play such a crucial role, Medicare evaluates each plan based on specific performance areas called domains. Medicare Advantage is scored on 5 domains, and Medicare Part D is scored on 4 domains. These domains help measure everything from patient experience to health outcomes. Now, let's take a closer look at the 5 key domains that make up Medicare Part C ratings. Staying healthy. This measures how well a plan keeps patients healthy with preventive care, including screenings, tests, and vaccines. Managing chronic conditions. This evaluates how effectively a plan manages conditions like diabetes and heart disease, looking at factors such as blood sugar control and statin therapy. Member experience. This is all about patient feedback. How easy is it to access care, coordinate treatment, and communicate with providers? Member complaints. This domain tracks the number of complaints patients file about their plan, as well as how often patients leave their plan altogether. Health plan customer service. This measures how well the health plan handles patient appeals and requests, ensuring they receive the support they need. These domains ensure that Medicare Advantage plans provide care and deliver high-quality experiences for their members. So, what about Medicare Part D? Well, it focuses on prescription drug plans. These plans are rated based on 4 key domains. Drug plan customer service. This measures how accessible a plan's customer service is, including the availability of interpreters and accessibility options for patients calling the plan's support center. Member complaints. Just like in Part C, this domain tracks complaints and attrition, measuring how often patients file grievances or switch plans. Member experience. This domain assesses how patients feel about their drug plan's performance, including how easy it is to access needed prescriptions. Drug safety. This measures medication adherence, ensuring patients follow prescribed treatments for conditions like diabetes and hypertension. These domains help ensure that Medicare Part D plans provide reliable access to essential medications while maintaining high levels of customer satisfaction. Now, let's talk HEDIS. It stands for Healthcare Effectiveness Data and Information Set. But here's what really matters. HEDIS tracks clinical quality measures, like how often diabetic patients get eye exams, or if patients receive cancer screenings on time. HEDIS is not limited to Medicare Advantage programs. It applies to all healthcare organizations. It tracks both health plan and clinician-specific scores. In other words, while STARS is a summary score for insurance plans, HEDIS is a more extensive set of measures scoring clinicians and healthcare organizations. Now let's dive deeper into how HEDIS evaluates performance. The key here is that measures are assigned different weights based on their importance. For example, preventive care measures like immunizations or cancer screenings might have higher weights, as they're critical for long-term health. HEDIS performance results are weighted, meaning some measures contribute more to the final score than others. Similar to stars, HEDIS-specific measures and their weights are also grouped into domains, 6 in this case, each assessing different aspects of healthcare quality. While all measures contribute to the overall evaluation, some carry more weight than others, meaning they significantly impact the final score. These weights and the specific measures used may change based on the organization and reporting year. These are the HEDIS domains. Effectiveness of care evaluates how well healthcare services prevent and manage conditions, including immunizations, cancer screenings, and chronic disease management. Access availability of care tracks how easily patients can access timely care, such as routine checkups, specialty referrals, and after-hours services. Experience of care. This measure measures patient satisfaction, focusing on communication with providers, ease of getting care, and overall healthcare experiences. Utilization and risk-adjusted utilization assesses healthcare usage patterns, including ER visits, hospital readmissions, and avoidable hospitalizations. Health plan. Descriptive information provides general details about health plans, such as enrollment numbers and network size. Measures reported using electronic clinical data systems. Tracks care quality using digital health records, ensuring accurate and efficient reporting. By analyzing these domains, HEDIS offers a detailed look at healthcare quality across plans, providers, and patient populations. So why does all of this matter to you? Well, these scores don't just affect big healthcare organizations, they impact clinicians too. For example, your documentation habits and the care you provide directly contribute to these ratings. These measures play a crucial role in ensuring patients receive high-quality care, directly impacting health outcomes. They also influence insurance decisions, including which clinics and providers insurers choose to work with. In some cases, HEDIS scores can even be tied to performance incentives, making them an important factor for both healthcare organizations and insurers. So, how do healthcare organizations track these scores? Some have built-in electronic systems that automatically flag gaps in care. Others rely on manual tracking or external audits. The best organizations have real-time dashboards to monitor key metrics and adjust care strategies accordingly. At the end of the day, understanding Medicare stars and HEDIS isn't just about compliance. It's about delivering high-quality care. The better your scores, the better the outcomes for your patients and your organization. If you're looking to deepen your understanding of value-based care, visit DoctusTech.com for expert insights, tools, and solutions. See you there.